Hi everyone, today we'll be presenting our county assessment over Pulaski County by Nicholas Kitchens, Trey Just, and Kacey Darling.
To better understand the health of Pulaski County, we first need a little background information on the county itself. Pulaski County is located in central Arkansas and is highlighted in red on the map. Pulaski is the most populated county in Arkansas with almost 400,000 people as of 2022. Little Rock is the county seat as well as the state capital, and some of the other sizable cities include North Little Rock, Sherwood, and Jacksonville. When we look at the population breakdown by age of Pulaski County, it looks very similar to the overall state averages. Pulaski County does have a slightly higher percentage of minors, or anyone under the age of 18, and working age people, those 18 to 64 years old. Pulaski does have a lower percentage of seniors, or anyone 65 years and older, and this makes sense as Pulaski is home to several large cities with lots of jobs, and people may leave the city after they have retired. When we look at the population breakdown by race of Pulaski County, we see several differences when compared to the overall state. We see a much lower percentage of whites and a higher percentage of most other minority groups. We'll talk about how this breakdown can affect overall access to health care and insurance. When we look at who has and does not have insurance, I've broken it down into several tables on the next few slides. First, here it is by age. Again, it's pretty similar to the rest of the state. Overall, Pulaski County has a lower percentage of people who are uninsured than the rest of the state, but we have higher amounts in minors and older adults. The working age group has a lower percentage of being uninsured than the state average, and I think that can be attributed to the jobs in Little Rock and people having insurance offered at their place of employment. This table shows the percentage of those without insurance based on income. We see Pulaski has a higher rate of being uninsured in those below and just slightly above the poverty level than the state average. In the other two categories, Pulaski has lower rates of being uninsured than the state, meaning more of these people have insurance. Again, we see issues of access to health care affecting the poorest in the county, and we'll talk about some ways to address this later in the presentation. This table shows the percentage of those without insurance based on employment status. If you are unemployed in Pulaski County, you have about a 50-50 chance of having insurance. While the overall rates of not having insurance are lower in Pulaski County, we still have a marginalized group that is going largely without any coverage. With our system that ties insurance access so closely to employment, it was still a shock to see these numbers. Again, we still need some system in place to offer affordable coverage and access to all. Being the most populated county, Pulaski has many options for providers and hospitals and the highest number of total providers in one county in the state. When compared to population, Pulaski County has about 2.5 times the amount of primary and over 3.5 times the number of specialty providers than the state average. We see many options in health facilities, including 9 major hospitals and many urgent care centers and walk-in clinics. One thing that is not accounted for in these numbers is that many people from the surrounding counties have doctors in these Pulaski County hospitals. Unfortunately, Pulaski may have a large number of providers and hospitals, but there are still many in the county who do not have access or coverage that allow them to get the care that they may need. With the higher overall rates of people having insurance and the high number of hospitals and health providers, Pulaski County should be the healthiest people in the state, right? Unfortunately, we still see rates of disease and low overall ranking among many health indicators. This chart shows some of these common indicators, their rates, and how they compare with the rest of the state. Pulaski County does pretty well in lower rates of smoking in both adults and minors than the state overall, but ranks near the bottom in low birth weight and infant mortality. We see there's still lots of work to be done to ensure that more people have the access to care in both physical location of the healthcare facility as well as ability to pay for the care.
So a new program that would benefit Pulaski County would be a charitable clinic initiative. This would help to establish free and charitable clinics for communities within Pulaski County. We already do have a couple of free and charitable clinics, such as the 12th Street Health and Wellness Center, Harmony Health Clinic, and Catholic Charities Medical Clinic. The charitable clinic initiative would provide services at free or reduced cost to economically disadvantaged and individuals that are uninsured. Pulaski County has a population of about 400,000, and 48% of individuals ages 19 to 64 in Pulaski County who are unemployed are also uninsured. As we saw previously, Pulaski County has high amount of current smokers, high teen birth, and high infant mortality. A charitable clinic initiative would help to lessen and reduce these numbers as well as provide individuals with quality care. And funding for this, we would have to apply for federal and state grants, fundraise at local events, and rely on volunteers and donations. The charitable clinic initiative would be beneficial to Pulaski County. While we do see higher prevalence and higher numbers of primary and specialty care providers per 1,000 people in Pulaski County, which is higher than most counties in Arkansas, the high rates of uninsured individuals means that people are less likely to have PCP or use health services if they're having to pay out of pocket. Paying out of pocket can be very expensive, so people are more likely to avoid healthcare altogether than risk having to pay a large amount of money. People are not able to utilize them if they are economically stressed and don't have the support to cover it. Free or reduced cost clinics increase access to healthcare, and we know that 48% of Pulaski County that is unemployed are also not insured, so they don't have employee benefits or job-based healthcare plans. With charitable clinics, the financial burden is lessened. Mental health issues and concerns would be decreased with less financial strain and stress, and this would also provide additional free or low-cost clinics that are available to the public, as they can help ensure the community has access to quality health care and proper preventative care, screening, and treatments. We've seen other free and charitable clinics, such as the 12th Street Clinic, to have been very beneficial and helpful to the community, so additional free and charitable clinics would further aid the community's access to quality care.
Our program idea focuses on a charitable clinic initiative. This initiative is to reach the greater portion of Pulaski County who are either uninsured or do not go see a health professional on the regular basis. Now, for this plan to commence, we first need to meet with the community. The community needs to know the importance of health and why it is essential to their well-being. On top of that, they need to understand why having a job is key to having some type of health insurance. Most people in Pulaski County are unemployed, which is about 48%. Those 48% are also probably uninsured, which is a very detrimental number for the amount of people who are actually getting seen at least one time a year. Now, we need to meet at a town hall on a weekly basis to help assist those with getting jobs, which will then also help them get health insurance. They need to help get checkups, and any other concerns they have will be talked about at these meetings. Second thing is to get in contact with hospitals to help with the free reduced health clinics. These charitable clinics are not easy to run, one, because most of the time they're less paying, or if not free services given out to the community. One, we need to engage with hospitals that have different free reduced clinics to spread their help to the community. On top of that, we need to discuss daily on how the operations is going and keep track of data involving patient visits and treatments. To help pay for any issues with the hospital staff working at these free reduced clinics, we will try to allocate funds for hospital assistants along with increasing their reputation among the state of Arkansas so they can either branch out and increase their hospital access to different populations in Arkansas. Third, we need to talk with businesses to provide job fairs for citizens. Like I stated earlier, 48% of Pulaski County is unemployed. We need to increase local business staff, decrease unemployment rates, and increase health insurance with job benefits. We'll do this by meeting daily because the importance of decreasing the unemployment rate is high due to the strong correlation between those who are not working and those who have no health insurance. To help mediate this, we will try to have an agreement that both free reduced clinics and businesses will inform the community of each other's presence to help conjugate a bigger visit upon both the hospitals, the free reduced health clinics, and the job fairs. Continuing on with the stakeholder engagement plan, we need to discuss with physicians to help provide additional support. One reason is because these physicians are helping us either providing extra hours or working at a less feasible rate than they would like to. So one, we need to provide incentives to those that help with the free reduced clinics. Two, we need to increase STD screenings. Pulaski County is prevalent in chlamydia and HIV. Out of 614 people of every 1,000 residents aged 13 and above are living with a diagnosis of HIV in Pulaski County, which is a very high number compared to all of Arkansas. We need to discuss with physicians weekly to make sure that the screenings they're providing are actually being beneficial and how many screenings they get per week. On top of that, we need to make sure they're compensated for their work, which we will use a timestamp to provide extra funds for those who reach certain amount of work hours a week. Next, I think we need to contact the school districts to help reach parents by passing out flyers. It's very hard to reach uninsured people when they don't go to a physician. One way of doing this is reaching them through their children. We can do this by passing out flyers that include the reduced health clinics on top of that, or we can also include the job fairs to bring home to their parents for them to see. One reason schools might be interested is because it's hard for kids to go to school when their parents are uninsured and unemployed, which then will turn back on the kids when they get sick and they'll start to miss school. This is an issue because school funding depends most of the time on student attendance. I believe this plan to increase health services for those who don't have any, and also those who are unemployed in the Pulaski County, will greatly improve in the next 2 years. We would like to have at least half of the unemployment rate go down in the next 2 years, which in turn should increase those who are insured in the county.
Lastly, here are the references we used.